Welcome to week 2 of Women's Wellness Wednesdays. This Golden Valley Health Center's project is funded in partnership with EMC Health Foundation. Remember, you can win a great women's wellness swag bag by sharing this content and tagging a woman you care about. Welcome to your 40s. Let's talk about how to help you live your healthiest life. The information provided in these slides is adapted from the Department of Health and Human Services Office on Women's Health. Not all of the information may apply to your life. Golden Valley Health Center's providers are available to help you get personalized health care. Call or text us at 866-682-4842 to schedule an appointment today. Let's talk about things that you can do each day to keep yourself healthy. You can choose to focus on one thing each day or work toward doing all of these steps. Eat healthy foods. Use the MyPlate plan to get started. Go to choosemyplate.gov for more information. Get at least 30 minutes of physical activity each day and at least 7 to 9 hours of sleep each night. Reach and maintain a healthy weight. Get help to quit smoking or don't start smoking in the first place. Limit alcohol use to 1 drink or less. Don't use illegal drugs or misuse prescription drugs. Take 400 to 800 micrograms of folic acid if you are still a premenopausal woman. Wear a helmet when riding your bike and wear protective gear for sports. Wear a seatbelt in cars and don't text or drive. There's also a lot you can do to stay sexually healthy at any age. Limiting the number of sexual partners and using a condom each time they have sex are 2 great ways people help protect their sexual health. Now let's talk about information that may be important for you to share with your provider at your next Well Woman visit. A Well Woman visit is a yearly preventive checkup, and it's a time to check in on how you're doing, how you'd like to be doing, and what changes you can make to reach your health goals. Some examples of things to talk about are if you plan to get pregnant in the next year, or what birth control method may be right for you. You may also have begun to experience perimenopause symptoms such as irregular periods or hot flashes. Also, talk about your weight, diet, and physical activity level. Talk about whether you use tobacco, alcohol, or drugs. Talk about any violence in your life, and talk about depression or other mental health concerns. It's also important to talk about your family health history, especially any risk of cancer, heart disease, and diabetes. Also, please share your unique story and tell your provider what makes you, you. At your next Well Woman visit, your provider may recommend the following tests, medications, or vaccines. The decision to get a medical test or procedure at any age is a personal one between you and your provider. These recommendations may not apply to every person. Some of the tests may include blood pressure, cholesterol, diabetes, PAP, and HPV. It's also recommended that everyone have at least 1 HIV test during their life, and tests for sexually transmitted diseases may also be appropriate for you. Your doctor may also recommend a mammogram, and you may need a test for tuberculosis. If you have any chronic diseases, your provider may recommend specific medications to help you manage your condition. It also may be recommended that you have certain vaccines, such as flu, hepatitis A and B, measles, mumps, and rubella, meningitis, tetanus, diphtheria, and whooping cough. Check out our other videos this week for women of all ages. Remember, you can win a great women's wellness swag bag by sharing this content and tagging a woman you care about. Schedule your appointment today by calling or texting 866-682-4842, and thanks again to our partners at EMC Health Foundation.